welcome to the Twinjitsu Podcast. We switched up our arrangement, so bear with us. Hopefully the camera angles are good. I'm Justin Wohler, black belt in Brazilian Jiu-Jitsu.
Chris Wohler, black from the waist down.
We're going to start like that.
Yeah, why not?
All right. And...
Wait, are we doing that again?
No, why?
Yeah, are you gonna get kicked out of fellowship or whatever?
I mean, I didn't even start yet. That's in July.
I
guess I'm gonna start. I'm gonna get kicked out before I even start.
And next or with us, we have a special guest. We'll just say Dr. Maruf. We'll keep your last name so you don't get kicked out of stuff. We'll keep that out.
What watch you rocking right there? Just a regular?
It's a Grand Seiko.
I've been
spring edition.
getting into some watches, just looking at them.
Yeah.
Oh yeah, I like
That's
that.
good for you to have. One day,
Yeah, I mean, I can't. One day I'll be able to afford one, but
was that like when you graduated or something, like a present or something?
No, actually, the funny thing is, I got this watch when I dropped out of my first residency, when I quit my first residency. Yeah. I dropped out of my first residency. I was like hella depressed for like, however many months. Then I like snapped out of it. I got a great job at a pharmaceutical company.
boo.
And,
We don't like big pharma here.
it was, trust me, that company is nothing but it's everything but big pharma. I call it small pharma. I don't even know what they're doing out there. Anyways, I got a great job doing nothing, and they paid me a bunch of money to do nothing. And so I was like, you know what? Like, I'm gonna treat myself. So I got a Grand Seiko Cherry Blossom edition. I think it's a SPGA 4A5 or something.
I don't know what that means, but
anyways,
I like it.
So where are you at in your med school journey right now?
Well, I graduated med school in 2019.
But I just consider, isn't the whole thing kind of like...
we already talked about it. We should have been rolling.
Oh, well.
He's in training now.
Yeah, I know that.
He's not in school anymore. He's done with that.
After you finish medical school,
I consider it school still.
I mean, some people do, some people don't. I mean, I think it's different.
It's almost like an apprenticeship, essentially.
Yeah,
But
kind
you're getting
of.
paid for
I
it.
mean, but I mean, I'm a full acting doctor.
Yeah.
I wouldn't say full acting as far as I'm not an attending, but I mean, I take care of patients. I prescribe medication, but under the supervision.
You ain't never
of
prescribed me
attending.
nothing yet.
Yeah, that Viagra's in the mail. I'm sorry.
Can you
for your
prescribe
loss.
stuff in different states or only in
Only in
where you're
Arkansas?
at?
Yeah. So I'm doing my residency in Arkansas, my internal medicine residency in Arkansas. I previously, after I graduated medical school at the University of Tennessee in 2019, I've started residency in Nashville. But for one reason or another, I left. Didn't do very well there, but I picked up where I actually restarted residency completely in Arkansas. I was fortunate enough to be given a second chance there and done well there. I'm chief resident currently at White River Medical
That's
Center.
a big deal.
And,
So you're at a hospital?
Yes, yeah. I'm in a small rural community hospital. It's the only hospital within I think an hour, and we serve like 40,000 rural patients.
You guys see bovine as well too, right out there?
Yeah, those are actually my neighbors. Actually, no joke. Like I think the closest cattle ranch is like maybe 15 minutes away. So. But yes.
And don't you think Arkansas calling you chief a little racist?
I've never thought of it. I've never thought of it that way. Actually, that's pretty good.
Something to bring up with your uppers, upper management.
I'll ask my mentor, Dr. Anthony.
What does that entail, being a chief?
So unfortunately, it means disciplining people from time to time. I think we talked, off camera about some of the issues that's been going on.
So you're kind of in like a management role on top.
Yeah,
of...
I mean, it's like cattling herd, right? But also but not just that. The
cattling herd. Is
I
that the
mean,
right word?
herding cattle. Yeah. I had a stroke. I'm
That's
sorry.
all right.
Just treat myself right. But yeah, I mean, my main role. We have 3 chiefs. My main role is to I shouldn't say discipline, but maybe like steer some of these residents in the right direction. But also, putting together schedules, lectures.
How much training do you get in med school and all that, like for the stuff that's non-medical?
None,
like
absolutely none.
Because you're essentially like a
Unfortunately.
business, you're a manager, you're like running part of the business. Like,
Yeah, I think eventually after people get out in practice, they have to run their own practice. One of my favorite docs, one of my closest mentors, Dr. Oster, he is the director or like the head of like the hospitalist group. And I mean, I don't know how much training he's had as far as running a business and being kind of a manager of doctors as well as at the same time being a physician himself. So that's a good question. Actually, I've never asked that. But my own experience, I've had none. I've only had failures that I've learned from, and I'm trying to, I guess, impart those lessons onto the next generation of residents and so forth. But I think that's pretty effective.
I'm going to ask a question. I'm not joking. This is a genuine question. How many people who become doctors do you think would be on the spectrum? That's a serious question.
No, I mean, that's a great question. My girlfriend Kayla, who was a badass ICU nurse for like 6 or 7 years, and now she's working at the PACU at Vanderbilt. It's like post-surgical care unit. She if you ask her, she'll say like 90%, right? I mean,
especially especially
like surgeons, man, like, and
yeah.
that's who she works with. Like, she works with urologists and orthodocs who think they're bros, but I mean, in reality, they're just nerds like the rest of us, and they're also on the spectrum like the rest of us. But I don't know. I mean, I would say about 50% of folks are probably on the spectrum. No swipe at orthos.
No, I mean, it's not. Well, it's not.
Orthodox are great.
It's not a bad thing. I was just curious.
Yeah. I mean, they're really smart, right? I mean, you have to have like some sort of fixation to do really well at these tests. So,
so you're a black belt. I don't know if we said that at the beginning or not. When did you get your black belt?
2022, I believe.
Too late.
October.
In my opinion.
Post residency.
Yeah. So I dropped out of residency in 2021. I went on this like self-discovery journey while I was also, working at this pharmaceutical company, and I had a lot of free time to also train jiu-jitsu. I kept training with Artista and under Felix, who eventually gave me my black belt in 2022. But in between like that time of dropping out of residency and by the time I got my black belt, it was cool. It was like I got to train with a bunch of other black belts like yourself and my friend Leo in West Palm Beach, and Gabriel Souza out in North Carolina, and a bunch of his black belts. And yeah, it was cool.
You trained at his school?
Yeah.
One of our guys trains there.
Yeah.
I don't know if he's still there or not.
Colton. Yeah.
How much training are you doing right now?
Little to none, unfortunately. It's so busy, and it not only is it busy, but I mean, I'm in a part of rural Arkansas where, like getting anywhere is like 40 to 45 minutes away. And so, fortunately, I found a great group of guys in Mountain View, Arkansas. Do you guys know where that is?
No idea.
Neither did I.
I heard it's got a good view though.
It actually does have a good view.
Mountain?
Yeah. That's good. That's good. They don't call me Chief there either.
I'm sure they call you other things.
Yeah, that's fair. That's fair. I train with a good group of guys about 45 minutes away. Whenever I can, they know I'm super busy. But Cole is his name. He's a purple belt. He moved from Jacksonville. He's a good purple belt, moved from Jacksonville. He's I believe ex-Navy. His wife is a advanced practice nurse practitioner at the nursing home, I believe, up there. But anyways, he has a great program for at-risk and impoverished kids for the community. So he has a massive house, and he opens up his garage and trains a bunch of kids for the community free of charge. Really great program, and he has opened up his garage to myself and a couple of other guys, Gage and Warner, who are both local blue belts in the area.
Is there any school there, or it's his garage?
It's literally just his garage.
Cool.
It's just his garage, and I mean he's doing a really great thing for the community. I was fortunate enough to grow up, with two parents, lower middle class, but they were around. I got everything provided for me. But a lot like rural Arkansas, man, it is rough out there. So he's doing a really great thing for kids out there.
What's his name again? Like, is there an Instagram? Or
Yeah, I think it's called Stoneforge Grappling.
Stoneforge,
I believe.
I'll get it from you before I post it, and we can post it.
Yeah, that would be great. I mean, I think any support would be awesome.
Well, we've been getting a lot of hate, so hopefully they get support.
Have you been reading the comments?
No, I don't.
Who's hating on you guys?
We got lots of hate for the Galval stuff we talked about, which
Andre, not the newest Galval.
Yeah.
What's the new? No, I'm just kidding.
You know what Mika said.
Well, I wouldn't bring him into it. He didn't have anything.
Right. I just think it's the link.
I mean, I hear nothing but amazing things about Mika. He
made a very good statement when
I don't even know what the statement was. What it was?
I mean, it was just like basically like, on one hand, this guy's my hero, my father. He's done everything for this, but then on the other hand, there's these allegations and like he needs to have a trial and blah blah blah. Just I think it was a good statement, kind of distancing himself, but also like, hey, this guy is my dad.
Yeah, I think that's fair.
Where were we at? Talking about training, and so how much training do you think you'll be doing? I mean, I know it's hard to say, but like once you're in your fellowship, you'll be in Memphis again, right?
Yeah. So I'll put it to you like this: when I started residency in Arkansas, I mean, I would make that drive, 45 minutes, about 2 to 3 days a week, and then actually I would train at my friend Bruno's gym, Westside MMA, in Little Rock. I think once every 2 weeks or so, and then we would have rotations in Little Rock through my residency program, and I would try to train as much as I could, but and I maintained a weight of like about 145 pounds, 150 pounds-ish. But then once like my second year, like the back end of my second year came around, I was just full on like applying, getting my application ready for cardiology fellowship. I was doing a bunch of cardiology papers and research and so forth. And I basically just dropped off. I mean, I went from like training, I would say 2 to 3 times a week to like none. I gained like 20 pounds because I just was literally just eating like crap and not having any training.
What's your go-to eat out in Arkansas?
A small place called McDoubles. Chef Ronald.
What are you getting there? The new, what's the new one?
No, the Big Arch is too expensive.
I think it's called the Big Arch.
The Big Arch. Oh, yeah. It's not. I think. I know.
I know. It's good though.
It's $10 though, man. Like just for the sandwich.
Yeah, I didn't even notice, but
man,
it's
I guess
big old burger.
It's thick, juicy. It's nice,
like it.
The way you like it. But I'm balling on a budget. I have a lot of credit card debt, so I'm usually getting the McDouble and a McChicken for $4.80 something. Sad that I know that.
Yeah,
And
but the
a water
price-
cup.
The price hasn't
I mean,
changed.
that
much.
was our go-to. I would either get a McDouble McChicken or 2 McDoubles, two McChickens, and a big old chocolate shake.
Yeah,
I was
Is that
so
good for my
fat.
heart?
Yeah,
I
it's
was
fine.
so fat at one point that a McChicken was my dessert. I would get 2 McDoubles and a McChicken for dessert. That's a true fatty right there.
That's pretty good, actually.
Does it bother you not training or?
Well, that's what I was getting at. Yeah, it does. It does. It bothers me a lot because now that I'm very, very fortunate and lucky, and had some really great mentorship to have matched into an extremely great cardiology program. I don't know why they took me, but shout out my mentor, Dr. Anantha. Shout out Deji, one of my other heroes. My program director, Dr. G, they paved the way for me to get into this great program in Memphis, and it's hopefully I will be back to training like 2 to 3 days a week at least. That's my goal.
So-
to give you a long answer.
We were talking about this, I think when we had lunch a couple weeks ago, but you're going to be performing. I don't know if you already are or not, but you'll be performing a lot with using your hands.
Yeah,
And you
yeah.
need the precision of your hands. Are you worried about, like, how are you going to approach training once, like, if you can't hurt your
Yeah.
hands like that?
To make a long story short, to answer your question, I'm just sick and tired of being fat and lazy, and I think I can
Man, if
really
you're fat, I don't want to hear the adjective you'd use for me. Holy cow!
Well,
You look swole right now.
I'm
It's the artista.
Yeah, the
hoodie.
artista.
shout out Felix.
Shout out Artista.
Got the
shout
muscle
out Artista. Always making really nice products. But I mean, I'll say this.
Ain't no GB wear, but I hear you. It's a joke.
Okay. No, I think I'm tired of being unhealthy and not being able to train because I can tell mentally, like, while I'm at the hospital, like, I'm like mentally fatigued, even though like I'm not like physically fatigued from training. Like I think there is something to be said about like, man, like I had a tough day at work. I don't want to think about work. And then, you go and train for, 45 minutes to an hour. And then you get to hang out with your friends for like 15 or 20 minutes. And you come home, you're tired from that, but you get some good rest and you go to the hospital clear-minded. When I'm not doing that, I'm not at my peak performance, right?
I think it is pretty crazy how the lifestyle that you have to live as a doctor is almost like the opposite of what you promote. It's like,
Oh yeah,
it
yeah.
seems
man,
like a
it's
very
crazy.
unhealthy, not to say, of course there's healthy doctors, but it's like the amount of work you have to do and the quick shitty meals you have to eat when you're trying to save people's lives for doing the same. It's crazy.
I mean, I'll tell you a quick story about my mentor, hero, cardiology king, Dr. Anantha. That when I was an intern, that means I was my first year of residency. I really when I restarted residency with like a clear mind, I had a direction of what I wanted to do, and I knew it was going to be hard. But I was like, man, this guy, Dr. Anantha, I keep hearing about him. He's the plug. I need to not only work with him, but I need to impress him. And so one day I was like in the cafeteria, like, I don't know, eating like a chicken nuggets or something like that, chicken tendies. And I was like, man, like how can I like do research with him? How can I do research with him? And then, it just literally, I was thinking about him. He popped up and this guy like was carrying like a sandwich in his hand. And I was like, oh man, like I need to ask him like right now. Like this is it. I hear he's so busy. He's always doing procedures, 16 hours of the day. Like he never has a break. So man, like I know he has just this small amount of time for me to go harass him and just be like, hey, Dr. Anantha, like my name's Maruf. Like I really want to do research under you. Like, what can I do? Like I'm all about it. Like I'm your guy. Man, like he was so kind enough to like put his sandwich down. He took a bite. I could see the bite, and it was like this like crappy veggie, like wrap or whatever. And he took a bite. He was like mouth full. He put a sandwich down. And he talked to me for like 15 minutes. And he was like, Maruf, like, I've heard a lot about you from Deji. Like, I have these 3 projects going on. Like, I want you to, write a draft for this project, start outlining this project. We'll collect data for this project. And then he just like was like, man, like if you're with it, like, just follow me. And it was amazing. It was like the 15 minutes he gave me, like really gave me the path for the rest of residency. But at the end of those 15 minutes, he got a page. He literally had 1 bite of his sandwich, and he was like, "Man, Maruf, I gotta go. This guy's having a heart attack, and I gotta go. I gotta go to do a procedure on him." And I literally saw him just throw away the rest of that sandwich. And there's no telling like how much sleep he had the night before. And he was having his lunch. It was like 2 p.m. You know what I mean? And he didn't even have a lunch. So you're right. It sucks, but it's the life that we chose, and it's our honor, I guess, to do it. So
Well put.
Sorry, that was a really long answer.
No,
but
that was good.
So when you're in Memphis, are you going to train at the place you used to train?
Yeah,
at? What's that?
yeah.
Memphis Judo and Jiu-Jitsu?
No, it's Memphis Grappling Academy. It's like I think they've changed their name to Alliance Memphis.
Oh.
I think, yeah, because
Cool.
I think it's owned by I think it is owned by Alexandre Meadows. He was Marcelo Garcia's first black belt, along with Josh Weiskin.
Yeah, I remember you like training there.
Yeah, he was a super nice guy, Brazilian guy. I got some really great friends out there too. Actually, one of the guys, Johnny Guerra, was in residency. He's doing his ER residency when I was in med school. Now he's an attending there, and he's one of the instructors there too. Whenever he gets time.
Sweet. Let's get into jiu-jitsu a little more. So,
What's up with the ears?
yeah, your ears are.
My mom was
insane
a
in this life.
Blockley.
Whenever I bring you up, people be like, the guy with the ears? I'm like, yep.
So yeah, I mean, this is going to go into why those ears were developed, but I always bring you up when I talk about deep half and over-unders, because that's your game, which is pretty much the Bernardo Faria game. Why did you gravitate towards deep half?
Man, I used to have some like convoluted like fake story about like, oh, it was just the game that complimented me, blah, blah, blah. And like, that's all stupid. I think I can confidently say that I was taking privates with my first jiu-jitsu professor, Bruno Amorium, who's out in Singapore, Gracie Baja, Singapore. But I was taking privates with him, and he was teaching me half guard stuff. And then he left, and then I started training super hard with Felix and yourself, and I started taking privates with Felix. And Felix was actually the one who was like, "Man, if you like half guard, you should check out this guy Bernardo Faria. Like he's like kind of crushing it right now, And this was like 2012, 2013. I think Bernardo had just gotten like second at Worlds, and he was like on the come up. And I was like, okay, cool. And honestly, I think because I have like this like I'm just gonna focus on like one thing.
Autism. We talked about it.
Yeah, there
at
it
the
is. That's the
beginning.
word. I didn't want to say it, but I was wondering if you were gonna say it. But yes, autism. I just did a deep dive on Bernardo Faria, and I noticed that he just kept winning and winning and winning. And I was like, man, there's like something to this guy. Sure, he's like triple my size.
Well, that's the weird thing. Is like most people your size are not playing deep half.
No, honestly, it's like autism. Like I shouldn't say autism, but like it's
hyper-focused.
Yeah, just being like hyper fixated on Bernardo and seeing that like, oh man, he's winning. So I just kind of went down that rabbit hole, and then
or underneath that rabbit hole.
Anyways,
it's a deep half joke.
So I eventually, working with Felix, we eventually like transitioned to like a kind of like a waiter sweep game. But I think it was like me transitioning to like medical school, and I just kind of, to your point, Chris, about training. I really didn't get time to train that much in medical school. I mean, I was at first I was like, oh man, I was all in, like, 4 days a week. And I mean, I was taking privates with you, Justin, as well. I was like all into jiu-jitsu my first year of medical school. And then like, I was like, man, I'm like not very good at medical school. So I had to like stop training and just, hyperfixate on school. And then like, I would like bounce around, I would still try to train like once or twice a week. And that was even tough. But anyways, long story short,
it's going to be the name of this episode, long story short.
Yeah, long story short, with autistic Sarwar, I just kept doing deep half because that's all I knew, and like my time is just so limited in medical school and in residency. The first time, I was just like, man, like I'm just gonna do what I know,
When you got your black belt, where do you like? Obviously, I think your A game, your deep half, and your over under, and then things spiraled off of that. Like you were a black belt, obviously, at those things. Where do you feel like the rest of your jiu-jitsu was? Because I think people are surprised when people get their black belts, like, yeah, especially years later, once they've seasoned in the black belt, like the level they were actually at to a certain degree.
Yeah, I think everyone, not everyone, but like most people have this like imposter syndrome in all aspects of life. When they get to the next level, they're like, who, me? No, certainly not me. But I had imposter syndrome when I, got into med school, when I got into residency, when I got back into residency, like I was just like, there's no way. And then when I'm, got into cardiology fellowship, it's like, there's no way. Like, no way. Like, I think I'm a good resident, or I think I'm a good med student, or like I'm a good like, pre-med student or whatever, but like certainly not good enough to be like a doctor or a cardiologist or whatever. But I think that actually happened to me when I got my black belt from Felix. I remember like the time, like it was like October, like I think it was like around ADCC where I was like, man, like, I think I'm a solid brown belt. Like I think like this is where I should have been as a brown belt. And, I'm going to work really hard to be like the best brown belt that I can be. And then like literally like the next few weeks after, like October, November, like I got, Felix was kind enough to give me my black belt. And I was just like, man, like that's crazy. Like I just met, I just took a bunch of privates from Gabriel's, at the time brown belts, now they're black belts, but with Gustavo, with Esteban, and with Vinny, who are like world class brown belt competitors. I think Vinny was a silver medalist at Pan Am's at brown belt, and Gustavo, he got bronze at brown belt. And I was like, man, I got my black belt before they did. Like, that doesn't make any sense. And again, it was like this imposter syndrome thing. But I talked to Felix about it. I talked to Leo, Gabriel, all these guys, and they were like, dude, like your path is like, you're a doctor, like your path is so like way different than like these guys who are competitors, like, so it is what it is. But I think I grew, when I got my black belt, I was like, I'm opening up my mind. My friend Leo really helped me with like, hey, you don't have to play like deep half and over under all the time. Like I'm going to like drill into you, like how to do a berimbolo, or like playing De La Hiva, open guard, and all that stuff.
Didn't you score points on Kolobate when you trained with him?
I have no comment on that.
Yeah, but
let's go ahead.
An orange belt.
Yeah, I mean, dude,
man. I think I'm gonna go. Let's cut that out.
No, shut up, dude.
I met him. I introduced myself to him like last year. He's
so nice.
So nice.
So nice. Yeah, he was like 14. And I will never forget it. He was like, I was a brown belt, I think, and he was like a green belt, and he was such a nice 14-year-old guy. Like, I mean, he was definitely like, I was like, man, this guy's 14. I thought he was like 25, I mean, obviously he's not, but he's just very well-mannered, like very, very mature. But yeah, like I think the ultimate sign of like respect to me was like, he was like, man, like, can we roll again? Like, I don't want you going back to like Nashville saying that like
You scored points.
no, it was actually like pretty like self-deprecating, which actually like speaks to like how like nice this guy is. You know, he was like, yeah, I don't want you going back to Nashville telling people how like crappy I am or whatever. And I was like, I was like, clearly like this guy's like,
And then he beat the snot out of you.
I think, man, again, this is like the autism or the hyperfixation.
You trained with him at AOJ?
Yeah, at AOJ. Like I think I like got deep half. I like did like the Faria like come up sweeper or whatever it is. I got on top and then like he like locked a omoplata and then I was just like, ain't no way. So I just like stalled for like 2 minutes.
All right.
But-
you heard it, Cole.
No, look, Cole will beat my ass. Like he will kill me. But I mean, man, like, you know, his dad is awesome though. His dad actually like pimped me on the valvular condition he had, and I think I got it right away. And I was like, oh, dude, that's no way. Like I've never met somebody with, you know, bicuspid aortic valve who, you know.
Hey, now.
I don't even know what the fuck you're talking about.
It's a valve where, you know, you have your aortic valve has 3 leaflets. He was born with 2. Yeah, and so like those patients are at higher risk of getting something called infective endocarditis. Sometimes when you get your teeth clean, that can happen. And anyways, he got some vegetations on his heart, and he got a mechanical valve, a biomechanical valve, because the traditional mechanical valve, you are required to be on pretty severe like blood thinners. And obviously, you know, Cole's dad wants to train with his son, and he's a good great black belt himself. He chose to get a bioprosthetic valve, which is typically for older folks because it doesn't require heavy blood thinners, it doesn't require warfarin, it's just aspirin. But you know, given he wants to train jiu-jitsu, like that would be an issue. So,
what similarities do you see between?
I hope that's not a HIPAA violation. I feel like he told me that.
You weren't his doctor.
Yeah, that's right.
Yeah, he told you.
I was just a stooge at the time.
You were just a brown belt that scored points on his 15-year-old son.
Yeah, I think he was 14.
Don't touch me. So, dang, I lost my train of thought.
Well, I was gonna ask you something. Just something.
Actually, hold on. You know,
oops, I was talking. No, I'm just kidding. Go ahead.
That same trip, I think I scored an advantage on.
Oh, come on. We can't talk about scoring advantages.
I might have been was it a sweep or an advantage? It was on the guy who looks like Tynan.
The guy who, you mean Tynan?
No. God, no.
The guy who, Jonathan?
No. Ooh, Jonathan's a nice guy. I like that guy.
An AOJ guy?
Yeah. He got like second at like black belt worlds.
Yeah.
Hoffa Mendes?
No, I'm pretty sure he got first.
Ace Mendes? Did you score on Ace Mendes, the little kid?
That's his son. Or one of their sons.
I don't know. It's just funny. We can cut that out though.
What
right?
were you going to ask?
Cut
We're
that
not
out.
going to cut it.
No, please cut that out.
We need more of
Just something that I've discovered somewhere recently, at least for me, and I was curious how you feel. I feel like deep half is very similar to just X guard.
Yeah,
how do you feel about
man,
that?
I bought Andy's
Murasaki?
Yeah, and Andy Murasaki's instructional. Man, that thing. First of all, that thing is awesome. He teaches very, very clearly, and very like basic terms, basic movements. But yeah, I mean, like when I was like going through the DVD, I was like, oh man, like this is like very, very, very similar. You know, like even just like the basic concepts that he like teaches throughout the DVD.
Yeah, fiddlesticks.
Or I guess like the instructional is very, very similar to a lot of the concepts that Bernardo teaches in his like half guard, deep half DVD. Concepts of like getting underneath the opponent, off balancing, grip fighting, letting go of like, you know, some collar grips to fight the sleeve grips and so forth. So yeah, I mean, very, very similar.
What, and this may seem silly to compare the two, but like what like similarities do you see between jiu-jitsu and
being a doctor?
Yeah, being a doctor, but but What?
I agree.
But what more like the journey, right? Like what has jiu-jitsu carried anything over to like when you went through residency, when you decided to stop, when you decided to do it again? Like, do you find any of those parallels or no?
Yeah, I mean, I feel like I used to be like, oh yeah, like jujitsu's like saved my life and this and that. I mean, man, like, I think if anything, jujitsu's taught me how to fail. I think. I mean, my first residency did not go, like, to be completely blunt, like it didn't go very well.
Well, that's because you were smoking blunts, right?
Yeah. That's
just
it.
to be blunt.
I was not. I was, for the record, I
That's
was
a
not
joke. For the
smoking
record,
blunts.
that was a joke.
I don't even know what those are. But no, I was not. I mean, I didn't take it seriously, you know, and I think there were many times in my jiu-jitsu journey where I didn't take jiu-jitsu seriously. And I had to, you know, whether it was Justin or Felix or, you know, I mean, Leo has yelled at me so much for not taking jiu-jitsu seriously. And I love that guy. I was in his wedding. I love that guy. But
he yelled at you in his wedding? Or you're saying you were in his wedding?
I was in his wedding, but
okay.
he did
He's
yell
just
at
in
me
the
in his
middle
wedding.
of the ceremony. Porra, work on your jiu-jitsu, man.
He's I mean, I think there have been many times. I mean, you know, Professor Reggie also, where, you know, I think a lot of times I've had to be sat down and been like, man, you need to take this like training seriously, or like, you know, you need to respect your time on the mats, et cetera. So, you know, I had to have, that was a difficult thing that I had to deal with during my first residency. And just learning how to accept failure. I mean, so many times people have tapped me, and you know, you feel, you know, I'm sure both of you guys have felt bad about, you know, like, you know, all of us in this room have felt bad about losing to someone that, you know, was a lower rank, or like making a mistake, and you just think about it, you know, you ponder about it time and time again, and just having to overcome those negative thoughts in your head, and having to, you know, wake up the next day and just being like, man, like, you know, how do I overcome this battle? I think that's something that jiu-jitsu has translated well to this new journey. Because I mean, for me, like, my whole identity was like, man, like, I'm a doctor. Like, I spent all this time schooling, and like I was a resident for, you know, so long, and like I like dropped out like close to the finish line. Like, man, like I'm a failure. Like, I'm a bum. But you know, taking all those losses in jiu-jitsu like really made me realize, like, man, I'm not a bum. Like, you know, I messed up. I need to like dust myself off the mat and take a shower, go home, sleep, come back and train again. And that's exactly what I did. You know, I came back to residency. I was very, 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 very lucky to get a second chance. And I couldn't have imagined the way it would have turned out. I mean, I got into the most competitive specialty that there is in all of internal medicine in the most competitive year, and into an excellent university program. You know, I mean, I'm just thrilled. And I think jiu-jitsu taught me how to fail, but also taught me how to overcome and succeed. It's okay. It's okay. You don't have to cry.
That was emotional.
Well, one thing, we got to work on your breath control, Vader. Over there, when you're off mic, just breathe off mic.
Yeah, that's
I'm focused on the
COPD.
guest.
That's chronic obstructive pulmonary disease.
Awesome. Cool. Cool.
Chris is going to be Googling that. Going
No,
through a
I know what
spiral.
that is.
What is it?
It's people get it when they smoke.
That's
And
good.
I'm not a smoker.
Anyways,
Well, so let's
I love you,
wrap it
Chris.
up.
what?
Yeah, it's been like 40 minutes. I'm getting hungry, dude. You talking about these medicines?
I thought this was gonna be like a Joe Rogan like
no.
20-hour extravaganza.
We are gonna have you check our balls before you leave.
Well,
but we'll do
I
that
have
off-
a tumor, so if
Well,
you want to feel what
I'll
that
ask you
feels
guys
like.
the same question, just because, you know, you guys have been black belts longer than me. What has jiu-jitsu translated, you know, as far as your own lives?
I mean, similar stuff
How has
like
jiu-jitsu translated?
losing and losing. Obviously, the health benefits too, right? We were both getting into jiu-jitsu overweight, bad lifestyles, and it's obviously helped in many ways with that. I do think like problem solving is something you get from jiu-jitsu, which is translated to other areas of life.
I have a less serious, I guess, outlook on jiu-jitsu and stuff. Like when you said people sat you down and said you need to take more jiu-jitsu more seriously, I kind of disagree with that. But that's just the way I've never been in jiu-jitsu to be. I mean, at one point I wanted to be a world champion, like especially at like blue belt. But dude, I enjoy the people I've met, and that's why I'm in it.
Yeah,
I think sometimes when you take jiu-jitsu too seriously, it takes the fun out of it. At least for me.
Yeah, I gotta agree. I mean, I think people during my first residency told me like, hey, you need to like take this seriously, and like, they were right. They were absolutely right. I didn't truly understand what I didn't understand the responsibilities that I had, to my patients and to the community. I can honestly say that. And yeah, that's an aspect where, yes, I need to take, things in my life seriously, right? Certain aspects, but you're absolutely right. I mean, I think the reason why I have, I think a pretty good bedside manner, and the reason why, old grannies in Arkansas, during my primary care clinic, during those weeks, they bring me cookies or home baked lasagna or whatever it is. I mean, I think it's because, yes, I do take medicine seriously, but a lot of aspects of medicine and just this human interaction, I don't take seriously. And I think that's exactly true. That's something that I learned in jiu-jitsu. Like, man, like sometimes you got to be playful.
Yeah.
Sometimes you.
That's when I have the most fun, personally.
Yeah, 100%. And I think that's, you're dialed in, you're taking things seriously, but you're playing and you're having fun, but you're also like your mind's more, I guess, malleable to learning.
Yeah, especially being in a position you're in now where it's like, and I'm sure you've already dealt with stuff like, you're going to have hard days where you lose a patient or whatever. It's like the last thing you want to fucking worry about is if your butterfly guard is good. Like you just want to go hang out with your friends.
Exactly.
Move around,
Man, my first rotation, in my cardiology fellowship in Memphis is going to be at Regional 1 in the cath lab. So that's literally the center where the most sickest, if that's a word, the sickest
you
uninsured.
Should know, Doc.
Yeah. Wait a minute. And English, and it's not. I didn't get a PhD in English. Where the sickest patients sickest and poorest patients in Memphis go to get treated for a heart attack. You know what I mean? And I'm going to have horrible days. I'm most certain of it. There are going to be patients who, unfortunately, will pass away on our table.
You heard it here first.
Have you dealt with that yet?
Breaking news.
Yeah. And actually, I mean, I think the person that I look to follow his example, I think Dr. Anantha, I mean, he is my icon. I mean, the way he handles failure, like, I mean, the way he handles, doing everything he possibly can for the patient. I mean, when you are on that man's table, you have a chance to live, and he will do his best to give you a shot. But unfortunately, it doesn't happen all the time. I mean, one case where he had was, we spent 4.5 to 5 hours opening up this nice elderly grandma's coronary arteries. She had, I think, like triple or quadruple vessel disease. She was rejected from having a bypass. So that means like the cardiothoracic surgeons were like, we can't even open up her chest and like give her a bypass graft. Like she doesn't have a shot. So he was
because like her vitals were so.
No, well, yeah, because yes, her comorbid. She had really bad COPD, pulmonary hypertension. Like her whole clinical picture was bad, but also her coronaries, her actual arteries were awful. They were like coffee straws, every one of them, so there weren't very good landing zones for that bypass to even be like sewn in, so Dr. Anantha was like, look, like these are your options: medical management, and you're gonna have another heart attack and pass away, or I can give you a shot, and she chose the shot. She knew the risks and benefits. And man, I saw that man do a 4.5-hour procedure, and it was artwork. I mean, all of the vessels were completely open by the end of the procedure. I mean, it's almost like we reconstructed her whole heart, right? And she woke up from the procedure. She was doing well, joking around with the cath lab staff. And usually we send these high risk patients up to the ICU for one night of observation, and then we discharge afterwards. Send her up to the ICU. She's awake, talkative, joking around with the ICU staff, and right away she codes. And we have no idea why, but man, Dr. Nantha rushed up there and did everything by the book. Coded her for like 20-30 minutes, and unfortunately she passed away. But
it's got to be tough.
Of course, yeah, and like in my mind, and again, I'm a young resident. I was a first year resident. I'm like, man, like all that hard work, like God, that sucks. Like that artwork, like just gone to waste. But then and I didn't do the procedure. Dr. Nantha did the procedure, right? And then I see Dr. Nantha standing there, and he's just like, teary-eyed. Like he never cried, but like he had he was composed, but he had water in his eyes, and just talking to the family, to the husband, was just like, look, I did everything that we possibly could. She tolerated the procedure well, and like I just don't know why this happened, but I'm so sorry for your loss. And and at that moment, I was like, man, like it's not about like him. It's not about like the immaculate procedure that he just did. It's about loss and that family, and how do you like portray and demonstrate like what you're feeling to the family who just lost their like matriarch, like, and that I learned more from that like L, as we say, L in the chat.
God,
I learned more from that than I did from any of the countless amazing procedures that I saw Dr. Nantha do. So,
and that's one thing Dr. Joe has always talked about, is like how important bedside manner is.
Yeah, absolutely.
And how to treat patients, and how a lot of doctors suck at that, but there are doctors who are really good at it. But yeah, I can only imagine that's got to be really tough.
Yeah, I mean, I think, like you look at a guy like Cole or Gabriel Souza, or, like Tynan, or, Andy Murasaki, I think especially Andy, actually. I mean, man, like that dude, one of the best competitors on the planet in multiple weight classes, has been second at black belt, like 4 or 5 years in a row, right? At many, many divisions. But man, like whenever he steps on the mat, there's always a chance, and he always gives himself a chance. And I think that's the type of doctor that I want to be, because I think Andy has faced so much adversity. I mean, he immigrated from Japan, he bounced around from, multiple schools, and I think he's gone through the hardship. So he knows like what it takes to not just win, but like how to handle defeat, and I think that's what makes Andy such a great competitor and a great champion. So I'd like to think that that's the type of doctor that type of cardiologist that I'll be, but I don't know. We'll see.
I'm sure you will. I mean, you're a people person, which is like you're extroverted, but you care about people and stuff. And I think that, and obviously you're smart. I think I have no idea. You're smarter than me. So
I'm not.
Smart.
I'm not.
But
you have good hair.
That already makes you a good doctor in my eyes.
Well, I mean, I think it's just all about, like, for me, I would not have been a good doctor had I not failed, at my first residency, had I not, dropped out and resigned. I mean, I think I'm much better for it. I'm better for taking that L.
All right. I have one last medical question. What's the safest thing to put up your butt? What's the safest household item to put up your butt?
There's actually a case report of a patient who is using atrial fibrillation.
What does that mean?
Yeah, so that's when your heart is not beating appropriately, right? Like, just to put it into so many words, like, you have two parts of your heart. The bottom part is the one that does like the heavy lifting, right? It circulates blood throughout your whole body. The top of the heart will pump into the lower chambers of your heart. So the top of the heart is not pumping in like a nice rhythm corresponding to the bottom chamber of your heart. So that's not a huge issue until you get a very, very fast rate. So when your heart rate goes above 110 beats per minute, when you're in this weird rhythm called atrial fibrillation, that's when it becomes an issue, because you'll be at high risk for a stroke and so forth, and your heart will eventually tire out. And
sometimes you can reset it, right? But like doing weird things like
that.
that.
So that's good. That's something different, but that's another type of arrhythmia called sinus ventricular tachycardia, SVT. I think they call it AVNRT these days, but yes, that's SVT. But that's when you do like when you do vagal maneuvers to try to reset the heart. But anyways, this guy was in atrial fibrillation with rapid ventricular response. That's AFib with RVR. His heart rate was above 110 or whatever this was. So this, I guess there was like a resident or a fellow or somebody did a rectal exam on this guy, and it actually popped this guy's rhythm back into like normal sinus. I think it was normal sinus, but yeah, it like completely resolved the atrial fibrillation.
Well, I know what we're doing after this podcast.
What, he just had a hunch?
I don't know. I didn't read the paper.
Okay.
I had
Please
no idea.
read that for the next episode so we can dissect that.
But yeah, long story short.
Yeah. Stick something up the butt.
Yeah. Long story short, rectal exam.
Well, thanks for doing this. Appreciate you. We'll have you back on again soon.
Yeah, thanks for the
5
opportunity.
years.
Yeah.
Once you finish med school. All right, see ya.
Yeah.